we're not yet at a point where you can do poop testing and diagnose a condition. There's no such thing as this generic probiotic that is the solution to all of our problems for every single person. That's silly. Fiber activates these satiety hormones, including GLP-1, to make us feel full. If you took a group of 100 men who have erectile dysfunction and you ask the question, what's happening in their gut, right? What's up with their gut microbiome? If we tested them, we would discover that on average, those men have less gut diversity compared to healthy men that do not have erectile dysfunction issues.
Welcome back to the Rena Malik MD podcast, your source for evidence-based information about your sexual health and more. I'm Dr. Rena Malik, urologist and pelvic surgeon, and today our guest is Dr. Will Bulsiewicz. He is a leading gastroenterologist and New York Times bestselling author of Fiber Fueled. He has an amazing platform all about gut health, and today we talked about how you can optimize your gut health and gut microbiome. What are the foods that you should be eating that you're not? And what are the foods that we're told about that are healthy, but really aren't? We answer the questions you all have. What are prebiotics that we should be having that will optimize our gut microbiome? What are probiotics that we need, and should we be taking probiotic supplements? We talked about fiber. What is the difference between different kinds of fiber, and how much fiber should we be getting, and where should we be getting it from? We talked about how the gut microbiome is linked to so many aspects of your health, from brain health, mood, and sexual health. We even covered toileting habits, like should you be using toilet paper or a bidet? Is there a benefit? How long should a normal bowel movement actually take? And what can you do to avoid itchy butt? We also talked about how chronic constipation is something that you might not even think you have. And what you might be thinking are gut sensitivities are actually chronic constipation, and how you can differentiate the two. We talked about the optimal treatment options for things like constipation and when it's important to see a gastroenterologist. We even covered what you should do for anal sex, how you should prepare, and what's the best way to go about it. Now, one quick favor, if you guys are enjoying this content, make sure to subscribe to the podcast or follow it wherever you're listening. This is a zero-cost way to support the podcast so we can reach more people around the world who are interested in learning about their health. Thank you so much for joining us, Will. I'm so happy to have you here.
Oh my gosh, Rena, it's great. I'm so happy to see you as well.
It's so fun to finally meet in person. I feel like we've been friends on social media, but we haven't actually met. And I that's the one part I love about podcasting, is we just get to actually connect in real life.
Yeah, it's really cool. And I have such great respect and admiration for the work that you do, and also the training and the publishing, the papers that you've done through the years. It's all really cool. And these are some more things that I'm interested in myself.
Yeah, thank you so much. I mean, I think we all get here in some way, shape, or form, but I think the common goal is we're trying to educate the public, and it's so important.
100%.
So I wanted to start with I think people want to know, what makes a gut healthy? What is a healthy gut? How do you do, what are the components of that?
Yeah, well, I think scientists have struggled to answer this question, because I don't think there's this one characteristic that defines universally a healthy gut. There's some basic concepts that we use. So one of them is the diversity within the gut microbiome. So we'll take a look. So let me start by saying this, that your body, your listeners may already have heard some of this, but your body is covered with invisible microorganisms from the top of your head to the tip of your toes. And they're most concentrated, though, inside of your large intestine, which is in your colon. And in that location, we have about 38 trillion microbes that include bacteria, fungi or yeasts, these things called archaea, which I find to be very interesting, potentially parasites. And in fact, some parasites are good for us.
Yeah.
And then viruses as well. And they are active in our physiology. They are deeply embedded in our physiology. So what we'll look at is how many different species do you have? And what we found, generally speaking, this is not universally true, but generally speaking, when people manifest disease, if you take a look under the hood, you see that there's typically a loss of diversity within the gut microbiome. So we tend to believe that diversity is a measure of health within this system. I also think that there is, not to get too nerdy with this, but there's some, what I would characterize as redundancy that exists. I don't think that it's just this one bacteria. And that's part of the problem that we have, is that we tend to reduce things down to the one bacteria.
Yeah.
It's a little bit like studying genetics. Where when we study genetics, like people want to know what's the one gene,
Right.
when in fact for most diseases, what we discover is like it's a multifactorial combination of many different things. So I think that there is a unique microbiome that can apply to many different situations, and that disease within the microbiome, we're not yet at a point where you can do poop testing and diagnose a condition.
Yeah.
We're not there yet. But that being said, like,
do you think we will be?
Yeah, I think so.
Yeah.
Yeah, especially I think that as we power up with AI, this is a data-driven thing.
Right.
There's tremendous data in the gut microbiome. A poop sample has a ridiculous amount of information. And if we take enough poop samples and then we apply artificial intelligence to that, we should be able to mine the data and identify specific patterns and combinations of microbes that are relevant to specific disease processes.
Yeah.
So, but like taking a step back for a quick moment, as a gastroenterologist, the way that I see it is this: like fundamentally, your gut microbiome is a part of the digestion of your food. When your gut is struggling, you will struggle to digest and process your food. And so the vast majority of people who have a damaged gut microbiome will on some level manifest digestive symptoms. The classic would be bloating. That's the number one that I would say. But it could be other ones as well. It could be abdominal discomfort, diarrhea, constipation. These things are all quite clearly associated with changes to the microbiome or acid reflux.
What I've understood about the microbiome is that it sort of changes all the time, right? Like it's not like it's like you have your fingerprint of microbiome. It's constantly changing day to day. Am I right about that?
Yes.
And so that's why sometimes you'll manifest these digestive symptoms, periodically, right? You might have ingested something that is less than optimal. But is it always food that causes disruption, or are there other things that can sort of exacerbate that?
There's so many different things that can exacerbate our gut microbiome. So, ultimately, like the way that I like to think about it is, if you were to capture your life over the course of 24 hours and think of all the things, think of not just how many hours did you sleep, but what time did you start to sleep? What time did you wake up? How consistent is that relative to other days? Did you exercise? What type of exercise did you do? Who did you spend time with? Do you have pets at home? Did you spend time outdoors? Were you exposed to sunlight? Everything that I've mentioned so far is not actually food.
Yeah.
I would argue that food is probably the most powerful lever that we have that we can pull.
Right.
But there are levers that we can pull that don't require you to lift a fork. And so I think it's important for people to be conscious and aware of this, that like this is the totality of your lifestyle that includes your diet, but includes all these other factors that ultimately creates an imprint, because different microbes, they're responsive to their environment. So in a way, like this is an ecosystem. The ecosystem, not to give people a God complex, but like you basically have command and control over this ecosystem on a certain level, and you can manipulate that. So as we learn more from a scientific perspective, people can absolutely, like this is one of the things that I want to help people to accomplish, is apply these concepts to your life to manipulate it so that it's working for you.
Yeah.
Right. Whereas the opposite of that is sort of what we've seen happen over the last 100 years, where we've wildly deviated from the diet and lifestyle that we evolved with. And now here we find ourselves as effectively evolutionary pioneers, living a life and eating food that has never like been exposed to these microbes.
Yeah.
Ever.
Right.
And we're kind of seeing what happens, and the results don't look very good.
Yeah, I think it's so interesting. Everyone's always looking for the one thing, right? The one thing they can do. But in reality, it's a huge number of things. And the one thing we're going to talk more about this, but I think people tend to throw under the rug is stress.
Yep.
And in today's modern society, living in a place where we're sitting a lot more, we're eating a lot more processed foods, we're not going outside, we might not even be interacting with people in real life because we're like all digitally connected. And then add to it stress, and people are like, oh yeah, I'm stressed, but everyone's stressed and I can't change that. And that's just how my life is. And I think that that's such a huge part of GI issues, urologic issues, that people tend to like underestimate how big of a part that plays.
Rena, this is a huge thing, and I appreciate and enjoy this, that at the University of North Carolina, as a part of my training as a gastroenterologist, I was placed into a clinic, to be honest with you, a little bit against my will. This was not what I wanted to do, right?
Yeah.
And I was placed into a clinic with someone, his name is Dr. Doug Drossman.
Mm-hmm.
All right. Now, we would literally see, like, you can appreciate that in a typical half day of being a gastroenterologist, you might see 20 people. We would see 2 people in a half day.
Wow.
We would spend hours
That's
with
like
people.
4 hours.
Yeah, and they would fly in from outside places usually. These are people that have like come for their 6th opinion. They've been to every single doctor. They've had every single test. And in many cases, they had like been to other experts.
Yeah.
And we would basically explore the connections between stress and trauma and things that may not actually be in their conscious mind, but are in their non-conscious mind, and make those connections for them, where the true healing would take place when you can help people to see that their problem is not, in fact, what they're eating or lack of exercise or sleep. Their problem is that something happened in their life. They haven't resolved that conflict and it needs to be resolved.
And it's hard work. That's really hard work. I was just talking to a veteran about this today. Like, I was like, came in to see me. He had an issue and with sexual function, but he also didn't feel comfortable with anyone touching his genitals because he had had a really bad experience in his service. And I told him, like, that's okay, but like, you got to work through that with somebody. Are you working through that with somebody? Are you talking to anybody? And unfortunately, he hadn't really had any great experiences yet with someone who could help him. And I was like, look, I'm going to help you as much as I can on the physiology of things, but I can't fix that, right? Yep. And every time you try to have sex, when you have that stress in your mind, you can't then perform or enjoy or feel pleasure or feel desire. And I'm sure the same thing applies to any issue, particularly like with gut issues, right? Like if you are stressed and traumatized, your whole body is.
Yeah, so this is 100% true. And basically what this comes down to is the sympathetic and parasympathetic nervous system. So we have this natural drive. Sympathetic is our fight or flight nervous system. It's like if you were to be attacked by someone, boom, your heart rate goes up, you're ready to defend yourself. That's your sympathetic nervous system. The opposite of this is the rest and digest, which is the parasympathetic nervous system, which is what you are activating when you're relaxing. All right, so this affects both of our fields. This is a common area. And the reason why is because in today's society, you talked about stress, that's sympathetic dominant. Like basically that's like having your foot on the accelerator of go, 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 and never being able to loosen up, relax, and de-stress. When people are exposed to trauma, it perpetually activates the sympathetic nervous system. They're always in fight or flight mode. They're always feeling a little bit threatened. And this can affect their digestive system in a negative way where they could manifest gut symptoms, bloating, diarrhea, constipation. But I would imagine, and you can vouch for this, I would imagine that this comes into play as well for men with erectile function.
And I would say urinary symptoms, right? Because our pelvic floor, which is very involved in GI issues as well as urologic issues, can be tense in response to stress and trauma. And that can affect how your bladder functions and how your sexual function and how you perceive sensation even sometimes. So absolutely. Now, I think this is obviously a lot for someone to take in. Like, I can't fix my trauma in a day. So what is the first step that you tell patients? Like, hey, you're coming in with digestive issues. What's the one thing they can change that's easy enough for them to start doing?
With regard to stress or more broadly?
With regard to, like, say they have digestive issues broadly. Obviously there's constipation, bloating, GERD, like different, but what was the one thing that you would say will help 90% of people if they can change this one thing?
That's a great question. So I'm very enthusiastic to talk about fiber.
Yeah.
But before we dig into that, I think where I would start is to say, actually, I think that there's tremendous power in creating a really healthy morning routine.
Okay.
And that would involve going outside, exposure to natural sunlight, taking a walk, and ideally a little bit of morning exercise to get your heart rate up. When you do these things, you are locking in your circadian rhythm. Our gut microbes love to be in rhythm. They love to know when the day starts, when the day ends. By getting that morning sunlight, your gut releases a tremendous amount of serotonin. And serotonin, perhaps many of your listeners have heard, 90 to 95% of serotonin is produced in the gut. We classically think of serotonin as being for mood or energy or focus, and that's all true. But in the gut, it's there for rhythm. It helps to maintain the rhythm of our gut. And rhythm, I think, is really underrated when it comes to gut health, because like if I were a cardiologist, if I could take a tremendous athlete, if I throw their heart out of rhythm, I could completely cripple them.
Yeah.
Right? With the gut, to me, I sort of see it in a similar way. When the gut is in rhythm, the microbes are happy. We're having good, healthy morning evacuations, good, healthy bowel movements. And when the gut is out of rhythm, this is where we have irregularity of our bowels, the urge to go, the sensation of going. We could have diarrhea, we could have constipation. So to me, establishing this morning routine that includes movement, includes morning sunlight, includes a little bit of getting your heart rate up and gentle exercise, there's many different benefits to what we get from that in terms of gut health. And if you have a good morning bowel movement, you're off to a good start in terms of your digestive symptoms for the rest of the day.
I want to talk about fiber, but so what is your gut like trying to tell you? Like say you're more bloated, you're more pain, you're more constipation. Is it telling you something different than whether you're having diarrhea, or like is your gut microbiome trying to like tell you like, hey, you've done something wrong and you need to fix it? Or is it just a symptom of something that you've done?
I mean, I think it depends a little bit. Like to me, these are symptoms, and I would want to understand the root of the issue. And that ultimately requires me to work towards identifying the diagnosis. So that being said, we know with clarity that there's a certain microbiome pattern that's associated with diarrhea.
Yeah.
We know with clarity, there's a certain microbiome pattern that's associated with constipation. So anytime that we're deviating away from that in rhythm, good, healthy, soft but formed, sausage-shaped bowel movement, anytime we deviate away from that, your gut is not happy. And we want to work to get it back to that center point so that we can get back into a good rhythm and feel well. So those symptoms definitely do say to me that the gut is not in a happy place.
If you're not having a bowel movement every day, every morning, let's say, does that mean that you're doomed to have worse symptoms throughout the day? Or do your symptoms tend to change? Or are people going to more often have more GI distress later in the day versus in the morning?
Yeah. I would love to teach your listeners a trick.
Yeah.
This is like one of my core tricks as a gastroenterologist that like, I know that you have this where you sit in a clinic and they're talking and you're like, okay, let me see if this, like the trick is going to work with them. In constipation, 100% of people are suffering with bloating. And if you give them a good, complete evacuation, a good bowel movement, the bloating goes away.
Yeah.
And it may go away for the rest of the day, or it may be just for a few hours. If you give them a partial bowel movement, then they may get partial relief of those symptoms, but then the symptoms come roaring back quite soon. So the key that I want the listeners to pay attention to is pay attention to the change in your symptoms that occurs after you have a bowel movement and how long it lasts. And recognize that for some people, if you're pooping every other day, that's totally fine. If you have no bloating and you're feeling well in general, this is just your rhythm. And you might be having adequate evacuations every other day. Flip side, there are definitely people who poop every single day and they need to poop more. And it may be that it's a partial bowel movement, or it may be that they're on a high fiber diet and should be pooping 2 or 3 times a day. So there are some people that they poop in the morning is fine. And by the afternoon, the bloating has started and it gets worse throughout the day until they wake up the next day and they poop.
Yeah.
And in that sort of context, my goal with that person would be to try to deliver a second good, healthy bowel movement during the day, typically with something that I'm doing in the morning to instigate an afternoon bowel movement.
Okay, that makes sense. I know you've alluded to this. Obviously, there's a connection in terms of how our mental health affects our gut health. But what about the other way? If we have an unhealthy gut, we don't have the diversity of microbiomes, how does it affect your mood and your mental health?
Yeah, very clearly, very strongly connected. So the brain-gut connection is bidirectional, meaning that the brain is affecting the gut and also the gut is affecting the brain. There's a few ways. You can get super deep and nerdy with this. So let me just kind of point them out. And if there's any you want to double click and take a deeper dive, let me know. One of them is through the vagus nerve. So the vagus nerve is an information superhighway. And this is one of the 12 cranial nerves. Now, all of the other cranial nerves stay up in the head and neck area. There's only one, sometimes they call it the wanderer nerve, where the vagus nerve actually travels down. It connects to the heart, to the lungs, and most powerfully to the gut. Now, within our gut, we have a ridiculous number of nerves. All right, it's thought that we have 500 million nerves. That is 5 times what we have in our spinal cord. And all 500 million nerves are constantly collecting information. That's what they're there for. And that information gets consolidated into this pair of vagus nerves that most of the fibers of the vagus nerve are to send that information upstairs to the brain. And then the brain receives this and acts based upon that information. So the vagus nerve is a really powerful way that the gut and brain are connected. The vagus nerve also helps us to bring to life our parasympathetic nervous system. Beyond that, the gut is constantly producing chemicals. And these chemicals have the ability to enter the bloodstream, and spread throughout the entire body and affect potentially the blood-brain barrier and actually in many cases, cross the blood-brain barrier and affect the brain itself. So a classic example of this, and we'll be talking more about this, are my favorite chemicals called short-chain fatty acids. And these three short-chain fatty acids, butyrate, acetate, and propionate, they're produced when we consume fiber, specifically fermentable fiber.
Okay.
That fiber is transformed by our gut microbes. It stops being fiber and it becomes fat, these three short-chain fatty acids. And these are the most healing, most anti-inflammatory thing that I've ever come across. They have healing effects right there in the gut, changing the dynamics of the gut microbiome, healing the gut barrier, suppressing and controlling, shaping the immune system in a really powerful, beneficial way. But also they enter into the bloodstream and they can travel up to the blood-brain barrier, repair the blood-brain barrier, and cross into brain tissue and have an anti-inflammatory effect. Now, the reason why this is important is that there's been the emergence of evidence in the last roughly 10 years that many of these both mood and neurologic conditions are associated with inflammation of the brain, which we call neuroinflammation. Depression, anxiety, Alzheimer's, Parkinson's disease are just a few. And if you were to reduce that inflammation, then the suggestion is that we can actually improve these specific conditions. There was a study that was done by someone at Deakin University in Australia. Her name is Professor Felice Jacka. And it's called the SMILES trial. And in this study, they put people on a plant-predominant Mediterranean diet. So basically, Mediterranean diet, extra virgin olive oil, fish, some red meat, but not too much, and a lot of plants. And when they did this, they actually saw that it had an incredible effect on major depression, to the point that it was conceptually similar to the effect that would be expected from pharmacologic intervention.
Are you sick of going to the doctor only to have them talk at you for 15 minutes and leave without knowing exactly why they're prescribing you this certain medication and what exactly the next step is to take to optimize your health? Wouldn't it be great to finally find a doctor who actually listens to you, answers your questions, and doesn't rush you out the door? Well, at my practice, Rena Malik MD, I aim to do just that. I specialize in taking care of patients who have issues with their sex lives, issues with their bladder, with their hormone health, or are having pain in their pelvic region or with sex. My goal is to give you the time and attention you deserve so you can leave with a clear understanding of your condition as well as our treatment plan that's optimized for your goals. During your visit, I'm 100% present with you for an entire hour. And after you leave, you can reach me. It is super easy to send me a message through our secure portal, and I'll get back to you within 24 to 48 hours. No questions asked, no hidden fees. Scheduling is easy. Just visit our website, renamalikmd.com/appointments. We see patients in both Irvine and Beverly Hills, California, and I see patients virtually in California, Florida, Illinois, Maryland, New York, New Jersey, and Virginia. Oh, and don't forget Texas. If you're outside these states, consider seeing me for an educational visit. I look forward to seeing you. That's impressive. Butyrate, isn't that, correct me if I'm wrong, but when people talk about the ketogenic diet, it's because they have more butyrate. Is that right, in the brain from fasting? So is it the same technical effect? Because people say, they get brain clarity when they're fasting. Are you getting the same sort of brain clarity from butyrate made in the gut from fiber?
Yes, but in an even more powerful way. Consider this. So let's take a person who's on the standard American diet, 10% plants. The number one plant is French fries, 60% ultra-processed foods, and 30% animal products that have zero fiber. And you take that and you switch to a ketogenic diet. I would argue this is a step in the right direction. Even if it's not high in fiber, it's still a step in a better direction, because assuming you get into ketosis, which many people do not, but if you do this the right way, you get into ketosis, your body produces beta-hydroxybutyrate and acetoacetate. Those are the two main ketones. Beta-hydroxybutyrate. This is conceptually similar to butyrate. It's slightly different from a chemical perspective. Acetoacetate. This is conceptually similar to acetate, but slightly different from a chemical perspective. They will activate the exact same receptors as butyrate and acetate. The issue is they're not as well designed to fit those receptors as the original butyrate and acetate. So you get the same effect, but it's to a lesser degree. On the flip side, if you were to take that same person and address their fiber deficiency, acknowledging that 95% of Americans are deficient in fiber, right? So this is like what my platform is about,
right?
Is trying to fix this problem, because I sincerely believe that we could massively change people's health by simply doing this. And if you were to address that and get them, not like, I'm not saying a vegan diet. It could absolutely be a Mediterranean diet. There's a lot of different variations of what you could do there, but get them where they are consuming an adequate amount of plant-based foods.
And what would that be, just to give people an expectation of what's normal? Because I don't think people know.
I think the easiest way is to think about if we were arranging a plate, right? If we were arranging a plate, then I would love you have to bear in mind that plant-based foods are inherently less calorie dense. You would need like larger volumes to get your calories.
Yeah.
Right. So if I were arranging a plate, I would love for 75% of the plate to be plant-based foods. And then the last 25% to be, whatever protein you choose. That doesn't have to be an animal-based protein at every meal. So, if you look at, go around the globe and look at the healthiest populations that are out there in terms of where they are in the 21st century, these are populations that are eating a plant-predominant diet. It's not a vegan diet. It's a plant-predominant diet that does include some poultry, some red meat. Those are kind of like not every meal, small portion size. They enjoy the flavor, right? It's not dominating their plate the way that we do it in America.
Yeah.
So, and that to me is the shift. To apply numbers to this, if someone were to use Chronometer, the app for nutrition, to apply numbers to this, for women, we would love for them to get 25 grams of fiber per day. For men, we would love for them to get 38 grams of fiber per day. Those are the lower limit of normal. In the United States today, most women are 15. Again, they should be 25. Most men are around 18. They should be 38. So we got a long way to go.
Can you eat too much fiber?
Yeah. You can, but it's relative. Can you exercise too much?
Sure.
Yes.
Yeah.
Right? Can you drink too much water? Yes. If you and I are taking care of a patient in the ICU, could we put them on 100% oxygen and hurt them? Yes. Many of the things that we need to be our healthiest selves, there is still a balance that exists. I like to think about it, Rena, like the gut is a muscle. Think of it from an exercise perspective. When we eat, we're exercising that muscle. We're making it stronger potentially if we eat these plant-based foods that have fiber and other good things. And so if I were counseling someone on exercise and they were going to the gym for the very first time, I would tell them, don't hurt yourself. Don't go too hard. Start off nice and gentle with an amount that you can actually handle.
Yeah.
Because time is on your side. So start with the right amount for you, but acknowledge that if you keep going back to the gym, you are going to grow stronger. You're going to be capable of doing new things.
Yeah.
You're going to add functionality that you don't currently have. The gut is the same way.
That's a great analogy. What about fiber supplementation? You said fermented fiber is the optimal kind of fiber. That is what you're getting from sort of prebiotic foods. Is that right? So like sauerkraut, kimchi, kefir, that sort of stuff.
What I would do is I would separate out fermented foods,
Yep.
which is, by the way, an entire conversation that we could have in addition to prebiotic.
Yeah.
And then prebiotic to me really boils down to, there are many things that can potentially be prebiotic. In essence, what this word means is that you are feeding the gut bacteria. They are different as a result of you feeding them, and then you receive a benefit on the back end, right? So this is a mutually symbiotic partnership where you both are better. And there's, to me, three main prebiotics that exist. Fiber, specifically soluble fiber, resistant starches, which resistant starches are not fiber, but they behave exactly like fiber. So you might as well think of them as being essentially the same thing. And then the third are polyphenols. And polyphenols are what are responsible for the colors of our food.
Yeah.
So like red berries or an orange pumpkin, carrots, there's about 8,000 different polyphenols. And it turns out that these polyphenols, the vast majority of them, about 95% of them, they're not digestible by the human digestive system. So they require our gut microbiome. Anything that you put into your mouth will ultimately come into contact with your gut microbiome. And the gut microbes have the ability to unlock and release these polyphenols. So like a quick example of this, Rena, you mentioned fermented foods a moment ago. So we could have an entire talk about alcohol, right? But with red wine, You hear people talk about resveratrol.
Yep.
All right, resveratrol is a polyphenol. You find it in many sort of purplish, reddish, violaceous foods. And some people say, and I've said myself, well, why don't you just drink grape juice? The pushback against that, me pushing back against myself from a couple years ago, is that fermentation leads to transformation. The resveratrol in red wine is more bioavailable and accessible than the resveratrol in grape juice. And so that's what separates that. Now, the beautiful thing about this is you are not required to have alcohol in the red wine. I realize it's fun. I've enjoyed having a glass of red wine myself.
Sure.
Right? But if your goal was purely health, then what you would do is you would get de-alcoholized red wine. It's still fermented. It still has that activated resveratrol, but it doesn't have the alcohol.
Got it. So prebiotics, soluble fiber, resistant starches, and polyphenols. That is good for your gut microbiome. And then fermented foods have a separate role, you're saying, basically.
Fermented foods have a separate role. And if I could, because to me, fermented foods is a little bit like a conversation about probiotics. And many people, they want to know about probiotics.
Yeah.
But before we go there, let's talk about prebiotics. Because the question that you asked a moment ago is, should people take prebiotic supplements?
Correct.
All right. So in my specialty of gastroenterology, like in many fields, supplements are not really accepted. In my field, this is completely mainstream in gastroenterology. It's written into our guidelines. We've been using fiber supplements for a very long time and probiotics. I have seen this firsthand. I've seen this because for many people, it's hard to get them to change their diet, or even when they have a healthy diet, they may still benefit from a targeted prebiotic supplement. So, but the issue around this, let me be fully transparent and acknowledge that I started my own company. And this company, 38 Terra, has our current product is called Daily Microbiome Nutrition. It's the prebiotic that I always wished that I could have. And the backstory on this, just briefly, I think that you would appreciate this, is like I was in clinic, front lines, working as a gastroenterologist, treating people with fiber supplements for 10 years. And then after I wrote a book, so many people started coming out of the woodwork to ask me publicly, what do you recommend? And I was not comfortable with the idea of coming out and being like, yeah, Benefiber.
Yeah.
Which is wheat dextrin, which is probably sprayed with glyphosate. And we have no transparency at all on the cleanliness of that product. So I got to a point where I was like, you know what, I think that we could do this so much better. So I felt compelled to create my own brand that takes advantage of the 21st century science. That includes, I mentioned that there's 3 types of prebiotics, includes all 3, from 7 different unique plant-based ingredients. That's a low FODMAP, so that means it's designed to be gentle on the gut. And we test it so hard. We do thousands of dollars worth of tests on every single batch. And we will soon be NSF certified, which basically means that like if you're a professional athlete, you can have 100% confidence that it's a clean product.
Yeah.
So now that's prebiotics. Let's talk about fermented food and probiotics. All right, so fermented food, basically, this is an ecosystem. In the same way that your gut is an ecosystem, there are microbes that live in this space and they ultimately achieve a balance. And this is how we go from starting with, for example, cabbage and submersing it in a saltwater solution. And 7 days later, it is now immersed as sauerkraut.
Yeah.
Completely different flavor. All right. The result of transformation that comes from these microbes. If you eat that sauerkraut, it has live microorganisms. They are diverse. They're not hyperconcentrated. So it's not the same as a probiotic, whereas a probiotic tends to be a concentrated, many times single or perhaps a couple different strains in an exact amount. With fermented food, our diet has been really sterilized in the last 100 years. We went from a position of eating a lot of natural food that grew in dirt, and fermented food, like if you think about cultures from across the globe, every single one of them, we could point to the cultural tradition and identify what fermented foods were absolutely loved through the years. And we kind of got rid of it all because we discovered preservatives and refrigeration and all these things that, like, I'm not saying they're bad.
Yeah.
Right. But we sterilized our diet in the process. There's research out of Stanford University, the Sonnenberg lab, where they took a group of people and for 8 weeks had them ramp up their fermented food intake. Here's what happened. So I mentioned in the beginning, your first question was, what's a healthy gut? I said, well, one of the things is a more diverse microbiome. In 8 weeks of increased fermented food intake, they had a significantly more diverse microbiome. With that, They looked at many different measures of inflammation, specifically several different cytokines, and they were dropping. As the microbiome becomes more diverse, we are developing an anti-inflammatory gut. So there are benefits to fermented food in that regard that a probiotic cannot provide. Flip side, if I have a patient with a specific health issue, there's a role for probiotics, but it needs to be targeted. There's no such thing as this generic probiotic that is the solution to all of our problems for every single person. That's silly.
Yeah.
Instead, what it is evidence-based solutions where you say, okay, my patient has constipation. My patient has bloating. My patient had C. diff infection in the past. These are potential indications where you would select a specific probiotic in a specific amount to address that specific issue.
And the probiotic, when you're taking it, I guess when you're putting anything in your body and you want it to get to the large intestine, like when you're formulating a supplement, how can you be sure that it's actually going to get there where you need to get?
Well, you can't. I mean, there are probiotics that are enteric coated. So basically what that means is they're designed to dissolve in the small intestine or more distally down into the intestine and release at that point. There's some really interesting stuff that's coming out now, Rena. We always believed that the probiotics had to be alive to be effective. That concept has been challenged very hard. Yeah. So there's now this new class that some people call them postbiotic or heat killed, or my favorite is they call them zombie or ghost probiotics. You kill the probiotic and then you still administer it and it still works.
Fascinating.
Now, again, in order to study this, like in order to recommend something like this, I'm not saying take your generic probiotic and intentionally kill it and think that it's going to work.
Sure.
Right?
Sure.
That's not the way it works. But like in studies where they now are taking this concept and applying it, they're discovering that you can achieve the same benefits in most cases. So there's the suggestion that it's not whether the microbes are alive or not alive. It's actually the microbes and like the structure of the microbe itself.
So I want to be clear. You don't think probiotics are like a panacea, like everyone should take a probiotic supplement?
If a person were to work with me in clinic, is there a role for probiotics? Yes. Would that be the thing that I recommend on the very first visit? Probably not. Could I recommend prebiotic supplements on the first visit? Absolutely yes. And I'm happy to unpack why that is, but really what it boils down to is we have a massive fiber deficiency. We desperately need more of it, and fiber helps everyone. Whereas probiotics, they need to be targeted, they need to be precise. And then, the last thing I'll say about the probiotics is if you're not noticing a benefit, they're not helping you. Stop.
Yeah.
Stop spending your money on that. Yeah. Because ultimately, the probiotic, you should have a goal, and it shouldn't be some generic idea. It should be like, this is what I'm hoping to feel. And if you don't feel it with that probiotic, then it's time to move on, because the problem that we have is that we all have a unique microbiome. And if you take these probiotics and introduce them into your unique microbiome, they may be accepted, they may do nothing, they may be rejected. You don't know until you try.
Right. So let's talk about fiber supplements specifically. When people are looking at fiber supplement options, there's soluble options, there's insoluble options, there's gummies, there's pills, there's powders. So how does the average person decide what is right for them? And are there certain that are better for just generally if they have no GI symptoms versus if they have constipation versus if they have loose stools?
The beauty of soluble fiber supplements, the fact that they're soluble means that they will dissolve in water. And so that gets rid of a lot of the texture issues, a lot of the grit that may be there. Whereas insoluble fiber, by definition, will not dissolve in water. So if you think about like the classic orange drink, right? That is typically psyllium husk. And psyllium husk has many benefits, but it's a combination of soluble and insoluble fiber.
Right.
And that texture can be hard for people.
Sure.
And this is why a lot of them, they do it for a little bit and then they stop because they don't like that. So soluble fiber doesn't have that issue. If it's a pure soluble fiber supplement, it will dissolve in the drink.
Yeah.
And I tend to favor soluble because that's what feeds and fuels the gut microbiome. Generally speaking, insoluble fiber will help with bowel movements, helps to add bulk to them, may help with some issues such as cholesterol, may help a little bit with blood sugar control. But actually, these things, we get more benefit from the soluble fiber.
Interesting.
Than we do the insoluble fiber. So I tend to favor soluble fiber supplements among the choices that exist.
Will soluble fiber work for any GI complaint? If you're like, will it help? And it's not going to fix it, right? But will it help like most GI complaints? So constipation, loose stools, bloating, that sort of stuff.
Yeah. So the answer is generally yes. The beauty of fiber in general, and specifically fiber supplements, which are more targeted than a dietary change and tend to be easier for the gut to adapt to. The advantage is that this is the only thing that exists that will bring diarrhea to the center and constipation also to the center. So the problem that gastroenterologists run into is if you treat diarrhea too hard,
they get
constipated. If you treat constipation too hard, they get diarrhea. So the beauty of the fiber supplements is it tends to bring you back to the middle. There is one caveat that I need to put out there, which is that if a person has mild constipation, a fiber supplement, increase your water intake, and then take the morning walk that I just described. All right. If you do those three things, you will poop and you will feel better. And you won't need to go any further beyond that. When we get further down the line, people that have moderate or severe constipation, it gets more complicated. As a pelvic floor surgeon, you know, many times there's pelvic floor issues.
Yeah.
Those people who have pelvic floor issues, a fiber supplement is not going to fix that.
Right.
So we have to address the root of the issue. It comes back to making the diagnosis.
Quick break from this episode to let you know I am so grateful that you're spending part of your day with me. I started creating content online to empower people to learn more about their bodies without needing to go see a doctor, pay a copay, wait in a waiting room, or find parking. And it has been one of the most rewarding experiences of my life. If you want to help support our mission of providing free education, please consider joining our premium membership. There you will have access to ad-free episodes, which are released early, as well as free transcripts and the opportunity to ask me anything. And these questions are answered in our monthly AMA episodes. Support the show and join today at renamalik.supercast.com. Can't wait to see you there. Yeah. Well, as you know, I think that it's important to give this information because sometimes you will help people, and they won't come to see you right away, right? And that's the real issue. You and I work in sort of stigmatized fields, right? So people are on social media looking for content and figuring this out because they don't want to go see the specialist because they're nervous or they're embarrassed or whatever. And so that's why I ask. I do think everyone needs an evaluation, right? Like if you're having issues and they're not benefiting by doing these simple changes, go see a gastroenterologist, 100%, right? So I want to be clear that I completely support that. And I think it's really important. But if you can help yourself by trying fiber, I think that's a great way to start.
Oh, 100%. I'm a huge believer in the same way as you are, in empowering people. I think that people, the days of paternalistic healthcare are over. And it's time for people to absorb knowledge themselves, become their own advocate, and be able to also have more informed conversations with their healthcare providers because we have less time.
Yeah, insurance has made that an issue. So what are examples of, so you said psyllium husk is a mix. What are examples of soluble fibers?
Yeah, so I tend to favor ones that are low FODMAP. And this is my preference as a gastroenterologist because FODMAPs are the fermentable parts of our food. One of the issues with fiber supplements is that it can give people gas and bloating. If it's a low FODMAP fiber supplement, it is less likely to cause gas and bloating issues. And so I tend to favor ones that are low FODMAP. So 38 Terra, our product, Daily Microbiome Nutrition, is certified low FODMAP. Other examples of low FODMAP, acacia fiber is also low FODMAP. Wheat dextrin that I mentioned a few moments ago is also low FODMAP. So these are other ones that are soluble. And like you could literally take acacia fiber or wheat dextrin and put it in your coffee or your tea. It will dissolve. And it can actually be a way, sort of a morning routine to maintain that regularity or that consistency of use.
Yeah, I love that. And we've talked about some examples of things that you should eat, but what are, let's name like 5 foods that people are probably not eating right now that they should be.
I would first say fermented food. Pick the one that appeals to you. I personally would love for it to be something on the spectrum of a plant-based fermented food. Like I don't want people to grab kombucha and start chugging it and think that this is like the solution to all of their issues. So a plant-based fermented food like sauerkraut, kimchi, miso, tempeh, I'm very happy with all of these. We all need to add fermented food to our plate. I'm a huge believer in legumes.
Mm-hmm.
So these to me are gut superfoods.
Yeah.
They are the most densely packed for fiber, specifically soluble fiber
Mm-hmm.
and resistant starch. And they still have a good bit of polyphenols.
Yeah.
So you're talking about like feeding the microbiome. And when you hear people talk about, oh man, like I don't do well with legumes,
Mm-hmm.
the reason why is because your gut is struggling because it's not used to you consuming this food.
Yeah.
As your body gets adapted to it, you'll find that you do really well with it. So I'm a big believer in legumes. I think that they're gut superfoods. I think the fruit is something that makes for a great snack,
Yeah.
and we have inappropriately vilified it. So I want to step up and advocate to say that I am not worried about the fructose that exists in fruit.
I mean, to eat the amount of sugar that you would get from like a candy bar would just be, you'd be stuffed.
It's different if you juice it, right?
Yeah.
If you're separating the sugar from the fiber, then I would have an issue with that.
Right.
But when you're talking about eating a whole food, this is a great way to introduce raw foods into your diet that also can help you with your fiber goals and make a great snack during the day.
Yeah.
So like I've always loved like having a piece of fruit in the afternoon. I think greens are tremendous, right? We're talking about the most nutrient dense foods that exist, great in terms of minerals, almost no calories. Not everything is fixed with weight loss in America. Like we clearly have a metabolic issue, right? The evidence would say 88% of Americans are metabolically unhealthy.
Yep.
And from a pure weight perspective, it's out of balance. And, 75% of Americans are either overweight or obese. All right. So having a food that delivers tons of nutrients in very few calories, that's a huge win from my perspective. The last thing, let me throw out sprouts.
I like sprouts.
Yeah.
Yeah.
So sprouts are cool because first of all, most people, kind of like fermented foods, most people are not eating sprouts.
Yep.
All right. What is a sprout? You can take any legume, so like a lentil or a bean, or you can take a seed, like a broccoli seed, for example, or an onion seed. And using a sprouting technique that basically involves a splash of water, a swish, and then just pouring it out twice a day. Takes 1 minute each time. That's it. Using that technique, you are activating nature's process for growth, which they call germination. And you don't need soil, and you could have a garden on your kitchen countertop. You could be in New York City in a 350 square foot apartment, and you could have a garden that is producing fresh organic produce that you will eat at the point of production, like as fresh as it can possibly be. And it is not expensive.
Yeah, no, my mom used to make sprouts for me when I was lactating, when I had my kids, because, there's some potential for improving lactation. So she would do that. She would literally, take our dals, which are Indian legumes, and beans, and she would sprout them.
Consider this: a half of a cup of organic lentils, dried sprouting lentils, specifically for sprouting. This costs like 30 cents. And if you follow this process, a half of a cup in 3 days will turn into 4 cups. It will 8x. And in the process of 8x, you have dramatically increased the protein. You have dramatically increased the fiber. You actually have microbes that are a part of this. It's a raw living food. You actually have enzymes that are a part of this. And you've also increased the vitamin content. So like this is a nutritional powerhouse.
Yeah, for sure. If someone is following like these recommendations, increasing their fiber, they will inevitably have weight loss, I assume, right?
To me, fiber is one of the opportunities that exists in a world where we create obesity with hyperpalatable foods. And we solve obesity with medications that require people to spend a lot of money and commit to the rest of their life without really knowing how that's going to play out.
Yeah.
These are my issues with Ozempic. Like I'm very happy that Ozempic exists for the people who need it.
Absolutely.
I'm not happy that we're turning this into the solution for everyone, including people who are not obese. To me, fiber is the potential opportunity because fiber activates these satiety hormones, including GLP-1, to make us feel full. And so in a world where 95% of Americans are fiber deficient, my argument is that we should address this issue on an individual basis and see where that takes us. And if that solves the issue for you, you win.
Yeah.
Because you will be not just losing weight, but you are going to have health throughout your entire body as a result of that dietary modification. It's not just an obesity thing. There's so much more that you get from that.
Absolutely. I don't remember where I read this or heard this, but there was, I guess, a time where they would try to make, processed foods and add fiber to them. They realized that people were not eating as much of it, or they weren't, and so they weren't selling as much. And so they took the fiber out of the processed foods.
Classic.
And I'm like, this would be amazing, right? If you added fiber to anything that we eat on a regular basis, like whatever your family, I don't know, whatever processed food that we eat on a regular basis, I think you'd see a huge transformation in health.
I think that the important thing, though, from my perspective, like, because we do exist in a world where soda is now prebiotic.
Yeah, that's true.
Right? And you pay a ridiculous amount of money for that prebiotic soda.
Yeah.
All right, let me just unpack that real quick. So first and foremost, I would much rather people get their fiber starting with their diet.
Yeah.
Yes, I have said here that I believe that fiber supplements can help. You can't out-supplement a bad diet. So we have to start with our diet first. Take that as far as you can take it. Supplements to me are about optimization. If I'm going to supplement, I want to do it the right way with high-quality supplements that are going to help me to feel better and achieve a more balanced microbiome. The fiber that you find in these sodas is the cheapest fiber that exists. I can't even tell you, because I know, having worked in the space, how inexpensive that fiber is. Pennies per can. Pennies, 2 cents, 3 cents per can.
Yeah.
The price gets jacked up because they added that in and they marketed it, and it is the most gas-producing fiber that exists. So that is the opposite of low FODMAP. That is a high FODMAP, basically concentrated FODMAP fiber that produces a ton of gas. And when you combine it with a carbonated water, you have a vehicle for bloating.
Right.
So from my perspective, look, if you enjoy those things, that's fine. But here's what I would say. Save your money, drink a Spindrift or whatever beverage you enjoy. And if you want a fiber supplement, add a fiber supplement and make it a high quality one. And it will be cheaper.
Yeah. Or just go to Costco and buy like the 24 pack of cans and, have your fiber supplement. In terms of things that are marketed to us, so you mentioned one, what are some other things that we're told? You mentioned kombucha too, but what are some things that we're told are good for us that are actually not?
I would defend kombucha. I guess my point with kombucha is that we shouldn't view that as like the solution to our problems. It's not a silver bullet, but nutrition is about replacements. It's about substitutions. What are you replacing with what? If you get rid of your artificially sweetened soda beverage or your sugar sweetened soda beverage and you replace it with kombucha, like, to me, that's clearly a step in the right direction. I worry about health washing that exists in our supermarket. It's going to come from products that are going to give you a marketing feeling that they are healthy.
Yeah.
This is all over the place. So like, where to begin?
Right.
Certainly in the protein space. Protein bars galore.
Yeah. There's very few that are actually good for you. Or I mean, like, if you look at the macros, right? There's very few that are actually reasonable.
Yeah, exactly.
Yeah.
And so the more complicated, a simple rule, I mean, I'm sure that people could point out one example where I'm wrong, but in general, if you look at the number of ingredients, the longer that list gets, the more likely we are to get into issues. If you look at the ingredients and you don't recognize what they are. I was a chemistry major in college. I look at these ingredients lists and I don't even know what we're talking about. Right? These are problems that exist in our food system, and they may be marketed as being super healthy. Be conscious and aware of the terms prebiotic and probiotic and gut health when we're talking about ultra-processed foods. It's still an ultra-processed food.
Yeah.
Be conscious and aware of high fiber in cereals and other things. Like, in many cases, they're adding, again, the fiber supplement to the product. And my thing is, no, give me the healthy product or give me the healthy food. And then if I want a fiber supplement, I will take that separately.
In terms of protein, you brought it up. So right now, protein's having a moment. I think people are...
You mean the perpetual moment?
The perpetual moment, right? That we need more protein and that protein is important. And I think we do. I think in general, people need to maintain protein intake for overall health. Obviously, you're biased, but what do you think is fiber more... Like, should we be aiming, when you're looking at your plate, should you be aiming to get the fiber goal over the protein goal, or should we be getting the protein goal over the fiber goal?
I think we can have both.
Yeah.
I think protein is important. I don't think we should sacrifice fiber. I mean, I can rattle off the laundry list of benefits that we get when we consume more fiber. Less risk of having a heart attack, less risk of dying from heart disease, less likely to be diagnosed with 3 different types of cancer, less likely to die from cancer, less likely to have a stroke, less likely to be diagnosed with diabetes. This is all from one study. I could go into the other studies with Alzheimer's disease and chronic kidney disease, and we could talk about erectile dysfunction. There's data for all of them. And here we are, 95% of Americans are missing this. It shocks me that there aren't more people trying to muscle me out of this monopoly that I have on the conversation with fiber. It's shocking to me.
It is actually shocking.
Okay, so
I agree.
the fact that I'm like the guy when it comes to fiber, and I'm like a lone wolf in some ways, hey, I'll take it. It doesn't mean that I dismiss protein and think that protein is unimportant. I am a little surprised that when we look out at the American public, we can use our own eyes and see that I don't think there is mass scale protein deficiency that exists.
Yeah.
Right. So true sarcopenia, protein deficiency, is something that I've rarely seen. And when I have seen it, it's in people that are very sick. Crohn's disease, ulcerative colitis, severe gut issues, cancer treatment. Right. This is the context that I see these types of issues showing up. That being said, I want to look good. I want to be strong, right? This is part of being a man for me.
Yeah.
This is part of the way that I feel. So to accomplish that, protein is an important part of me being able to build my muscle mass.
Yeah.
I'm typically striving for a goal of 1.2 to 1.6 grams of protein per kilo of body weight. I think that many of the estimates where people say like 1 gram per pound are way too high and unnecessarily high.
0.7. I think the real number, well, anyways, we can talk about that later, but I agree. So I think that I will say, though, I do see frailty, just to add that. Even though we don't see sarcopenia, we certainly see as patients age, frailty becomes an issue. And that's where I do think optimizing protein and muscle health is really beneficial.
Exercise, so as people age, yes, protein goals go up when we get past age 60.
Yes.
We need more to protect that muscle mass.
Yeah.
But also, people are laying on the couch.
Yeah.
We need to be out there and we need to be physically active.
Absolutely.
The data say that we spend 88% of our day indoors. That doesn't even include in the car.
Yeah.
When you include in the car, it's well over 90%.
Yeah.
So what exactly are we doing when we could be outside and moving our body?
I mean, I wish that was true every day. I really, there are some days where even I don't get a chance to go outside. So I want people to know they're not alone.
That's keeping it real, and I appreciate that. And
Yeah.
I understand because I am busy as well.
Yeah.
I think though that we have to take a step back and also be honest on some level. It's not you, but I'm speaking broadly and globally, myself included. I'm targeting myself right now. The average American adult spends 6 hours on devices per day.
Yeah, we really do.
So if we took 30 minutes out of that, that's a great amount of exercise. If you do 30 minutes a day,
Yeah.
you're doing great.
No, absolutely. I mean, I think that it's absolutely doable. I mean, you can just start with baby steps, right? Like 2 minutes outside.
100%. And I 100% believe that just movement and being outside and reconnecting with nature, 30 minutes taking a walk, that's a huge win. It doesn't have to be complex. It doesn't have to be I'm not sure what kind of exercise to do. No, just take a walk.
Yeah.
You win.
You mentioned fiber can help, or there is a correlation between fiber and erectile dysfunction. How does gut health impact sexual function?
All right, let's do this.
Do it.
So I might need your help on some things here, Rena, because you're the expert on sexual function. And let's start with this. There are risk factors for erectile dysfunction, hypertension, hyperlipidemia, diabetes. Every single one of those things, there's clear-cut evidence that gut health plays a role. Clear-cut evidence. And by the way, fiber has been shown to address in randomized controlled trials blood pressure and lipids and blood sugar control. So that is one of the opportunities that we have, is that the gut is connected to our metabolism. Hypertension, hyperlipidemia, and diabetes or lack of blood sugar control are all indicative of a metabolism that's out of balance. It needs to be healed. When we heal our gut, one of the benefits that we receive is improved metabolic health. Number 2, one of the things that's quite strongly connected to erectile dysfunction is inflammation. And inflammation can affect blood flow. That's interesting because the gut is clearly connected to inflammation.
Yeah.
70% of the immune system is actually resident in the gut. And when that immune system that's resident in the gut gets activated, it releases cytokines. Those cytokines activate inflammation throughout the entire body. And there's pretty clear evidence that inflammation is connected to erectile dysfunction. Out of curiosity, since the pandemic started, have you noticed an increase in erectile dysfunction?
I have, yes, but The reason being is people are sitting more. They're getting high tone pelvic floor, which is then affecting blood flow to the penis. So that's one of the big reasons I've been seeing after COVID, because now people are working from home. Before they were at least walking to the car and walking around their office, and now they're just sitting at home.
Got to get up and move around.
Yeah, so that was one. But yes, I mean, certainly people who had COVID, who got inflammation, also had
Like long COVID.
Yeah, had erectile dysfunction afterwards.
Exactly. It's one of the manifestations that can occur. And they too typically will also manifest gut symptoms at the same time.
Yeah.
So showing the connections in real time that exist between these things. There are some people where anxiety and stress play a role in erectile function. And it goes back to what you and I were discussing earlier with the autonomic nervous system, this balance that exists between sympathetic and parasympathetic. And in order to activate blood flow to the genitals, we need to activate the parasympathetic nervous system. So
remember, point and shoot in med school.
Exactly.
Parasympathetic to get the erection.
Oh man, you're kicking me back to 2003 right now.
Sympathetic to have the ejaculation. Yeah.
Sympathetic for the ejaculation and anxiety in general, right? Where, as we discussed earlier, through the brain-gut connection, there are ways in which the gut does play a role in affecting our mood. I am not, by the way, claiming that this is the only thing, right? There's other aspects.
Sure.
But I do believe that this is part of the story of how we can actually improve our health and address those issues.
Yeah.
Right. So we've talked about metabolism and metabolic risk factors. We've talked about inflammation, and we've talked about from a psychological perspective. Now let's focus on the gut microbes themselves. Of course, testosterone plays a role in the ability to get a vigorous erection. In women, there's specific microbes associated with female sex hormones. And we actually have a word for it, which is the estrobolome. I'm not aware that there's been a word for men's microbiome, whatever. We could come up with something for that.
Sure.
But there are microbes that have been found to be associated with the production and activation of testosterone. Specifically, there's one called Clostridium scindens that's been associated. And if we take a look, like if you took a group of 100 men who have erectile dysfunction and you ask the question, what's happening in their gut, right? What's up with their gut microbiome? If we tested them, we would discover that on average, those men have less gut diversity compared to healthy men that do not have erectile dysfunction issues. There do seem to be these opportunities. I don't want to sit here and make the claim or make it seem like this is a direct, the microbes and erections, right? But like, I think that the way that in general the body works is that like we can elevate our health. And when we elevate our health, we're rising the tide on many different aspects. And that can include sexual health, sexual function.
And potentially hormonal health, you would say too. Do you think there's
definitely.
Yeah.
I've been thinking about this. So one of the topics that I think a lot of men want to know is, what do I take to elevate my testosterone levels?
Yeah.
So, and I've seen, you tell me what supplements you would recommend, but like what I've seen is recommendations are things like, for example, zinc. Okay, that's interesting. Zinc definitely repairs the gut barrier.
Zinc has a lot of actions on the body, right? Multiple actions.
Yes.
Yeah.
So again, like these things, it's hard to prove that it's exactly this.
Yeah.
But when you repair, I know for a fact that zinc repairs and restores the gut barrier. When I was at Northwestern for my internal medicine residency, we would treat people admitted to the hospital with hepatic encephalopathy. We would treat them with two things, zinc and antibiotics. And I didn't realize until many years later when I started really studying the gut microbiome, both of those things that we were doing were actually helping to repair and restore a healthier gut microbiome, which was preventing them from having this hepatic encephalopathy. So like that condition is a gut mediated thing. So zinc is an example of one. Heard people talk about antioxidants like quercetin. Quercetin is also clearly beneficial to the gut and gut microbiome. It's a polyphenol and it's prebiotic. So what
Are you feeling in a rut in the bedroom, wishing you had the kind of sex life you could brag about? I've spent years helping patients and creating content for people all around the world to improve and optimize their sex life. Today, you can get my knowledge for 100% free with my new ebook called Better Sex, Better Life. In this ebook, I review my top 10 tips for improving your sex life, all from the comfort of your own home. All you have to do is go to renamalicmd.com/morepleasure to download it for free today. I would say that the data is not super strong, but if you're talking about minerals, it would be like zinc, magnesium. And boron.
Yep.
If you're talking about other supplements, there are some like Tonkat Ali and there are a handful. The data's not like super strong.
Yeah. And Tonkat Ali, I don't know enough about to say what the effects are on the gut microbiome. I haven't seen a study on that.
But I would say that none of the supplements have robust data and it's very individualized. Like if you have a deficiency in zinc, magnesium, or boron, yes, I think it would be helpful. If you don't, then probably not.
Testing can be really helpful, I would imagine, right?
Yeah.
Because if a person were wanting to approach using that strategy, ultimately what helps is like, how do you feel and what's happening with your testosterone levels?
Right. Yeah. Exactly. So a couple other questions about gut health that are sort of related. We talked about alcohol a little bit in terms of red wine. How does alcohol, marijuana, other drugs, any yeses and nos in terms of those categories?
Yeah, I'm like gonna ruin everyone's fun, so please, I apologize. The truth is that the data that I've seen has me worried that alcohol is causing harm to the microbiome. With total clarity, if you drink to the point of having a hangover, you have caused harm and damage to your gut microbiome. The spot where it gets quite much more debatable is when we talk about something in the spectrum of 1 to 2 drinks and, potentially not causing any sort of effects on the following day, no hangover effects seen. It's less clear what happens there. But there was an interesting study that sort of changed my perspective on this, and I just came across it in the last few years. And I really tapered back my alcohol consumption after seeing this. So they took a group of people and they had them drink, it was vodka, and it was a significant amount. What they did is then they tracked the blood alcohol level and their blood lipopolysaccharide level. Lipopolysaccharide is something that is leaked into the bloodstream when our gut barrier is damaged and broken. So you find it in your gut, like in your gut microbiome. It's not supposed to be crossing into your bloodstream except when there's damage or injury to the gut microbiome. And what they showed was that basically these were parallel graphs. You could weigh them over the top of one another. When the alcohol level spiked, so did the lipopolysaccharide level. When the alcohol level came down, so did the lipopolysaccharide level. The lipopolysaccharide level did not normalize until the alcohol level normalized.
Fascinating.
So from my perspective, based upon that, that doesn't answer the question, is one drink harmful? That's not exactly the same question.
Right.
Right. But the fact that the alcohol level on all levels in all amounts was concurrently associated with an increase in the lipopolysaccharide, and acknowledging just the real world, where if I have a drink and it's only one drink at 2 p.m, I'm going to feel tired in a couple of hours.
Yeah.
Right. It leads me to believe that that alcohol is causing harm and injury.
Yeah. Well, I mean, there's also so much data now that no alcohol is good in terms of cancer prevention.
100%.
So I've stopped myself too.
And REM sleep is clearly disturbed by even one drink.
Right.
So exactly. there's other aspects as well. Marijuana has emerged with, like, as alcohol seems to be becoming less popular, marijuana has become much more popular. I have serious concerns about this. Now, part of it is the cognitive effects. We used to call them like a pothead. That's real.
Right.
They've actually studied this and looked at brain size and shown that the brain shrinks with chronic marijuana use. But in my space as a gastroenterologist, there's something that happens called cannabinoid hyperemesis syndrome. Let me paint a picture for you. A patient, typically a younger patient, comes into my office, says, I've been like throwing up around the clock. What's going on? And I ask one question. Do you love taking hot showers? They're, yeah, I feel so much better. I could take them for like an hour straight. That person, like, ultimately I have to work to like get the question directly answered.
Yeah.
Sometimes the parents are in the room.
Yeah.
But that person, that's cannabinoid hyperemesis syndrome. The chronic use of marijuana can ultimately lead to the development of chronic nausea and vomiting, sometimes called cyclic vomiting syndrome.
Yeah.
And the problem is that they feel better when they smoke. So getting them to quit can be quite challenging. And you have to educate, but sometimes you also have to give medication for support.
I never learned about that. That's fascinating.
Yeah, it used to be a rare thing. It used to be like you would sound, in residency super smart if you brought up this concept.
Yeah.
Now it's out there all the time.
Wow. That's so interesting. I want to touch on toileting habits. Sitting on the toilet for too long, what harm does that cause?
think that my main concern is the effect that it has on the pelvic floor and specifically hemorrhoids. So hemorrhoids are these 3 beds of venous tissue that carry blood. Think of them like an airbag for a car. They're there to protect us. And most of the time they're not filled up with blood. But when you sit down on the toilet and you're about to poop, they fill up with blood. The more time that you spend, the more time that those tissues are filled with blood, and it can be harder to get the blood out of them afterwards. And this can make people prone to developing hemorrhoids. So hemorrhoids by the age of 50, about 50% of people have these issues.
Wow, 50%?
Yes.
I did not know it was that high.
And they wish they did not.
Yeah.
And one of the reasons that this happens, like people classically think of it as being purely constipation. Yes, bearing down does promote flares of the hemorrhoids. Also, any change in bowel habits, not just constipation, but also diarrhea can make them more likely to happen. But the fact that you sit on the toilet for too long is problematic. So what I've always advised people is 5 minutes. So like, don't force it. Don't push super hard to get it out.
Yeah.
But don't sit with your phone. I think this is kind of a guy thing.
No, I think it's an everyone
It's
thing.
an everyone thing. Okay.
We like hide from our kids in the bathroom.
Yeah, it's like a quiet place.
Yeah.
Yeah. Kind of nice to have a minute.
Although my kids will still walk in, I'm like,
Yeah. Mine too. Sometimes our nanny as well. But yeah, no, you want to keep it ideally 5 minutes, but like certainly less than 10 minutes.
Yeah. What about using a bidet versus using toilet paper?
I'm 100% team bidet.
Oh, me too. I love bidet.
Oh, I think it's one of the best things that you can spend your money on, honestly. Like if you want to...
It's not even that expensive.
No, it's not.
You get on Amazon for like, I forget, it's so inexpensive.
Yeah.
Yeah.
Oh, it's the best. And it's also, by the way, a great way to clean the bottom. So one of the issues that exists is many people use wipes. I would caution you against that because the body has a natural moisture content and also natural sort of oils that are a part of that part of the body. And when we use wipes, we dry them out. And that's actually the #1 cause of what we call pruritus ani, which is anal itching.
So that's, very similar in women in the vulva, which they'll use wipes or they'll overwash. And I'm sure it's similarly in the rectum or the anus where you'll overwash and you develop itching. Yeah. And you develop discomfort and dryness. And for women, oftentimes they'll come in with symptoms like, oh, I think I have a UTI. Yeah. But it's really a lot of overwashing and over cleaning the area that naturally doesn't need that much aggressive cleaning.
Sometimes the hemorrhoids need to be treated when people have anal itching. A very large percentage of people, if you quite simply tell them to take a break from washing their bottom, stop using any wipes or any sort of lotions or anything that could dry out the space, and then reduce the temperature of your shower, it will get better. And washing with water is still perfectly hygienic.
I want to end with talking about anal sex. So certainly anal sex has become more commonplace, I think, more accepted in both heterosexual and homosexual relationships. What are tips as a gastroenterologist you would say, knowing like the health of the tissues, the safety of doing that without injury? What are tips you would have for the average person?
So I think that this thing is something that should be entered into with a partner that you feel safe and comfortable and you can communicate with. I think it's really important to like have that ability to communicate so that you don't rush and you can ease into it. So, and when I say ease, I don't actually even mean like jumping straight into anal sex. I mean like working through what could be a period of time where it's foreplay, right? Or using toys and starting small and then working a little bit larger over the course of time to get that part of the body used to it. It turns out that these tissues in the bottom, basically like there's 2 things that you'll find there: muscle tissue and skin. And they both kind of need to be adapted before moving forward with doing anal sex. Yeah. So by introducing first smaller things and slowly progressing, it gets the area adjusted to it. It allows you to see how it feels, see whether or not this is something that works for you. And in a way, like in the same way that we develop a callus on our feet by walking on our feet, right? It sort of helps that skin to get a little bit tougher prior to moving forward with anything. So now, once you sort of move beyond that, then I think it's important for people to do this in a way where it's pleasurable, it's comfortable. You can stop it if you want to, using a lot of lube, going slow, and when on the receptive side, breathing. Yeah. So like, I think like those are the basic tips. Afterwards, again, like I don't think that using wipes is advisable. Using a bidet absolutely is fair game. And then if you have bleeding, fiber supplements can help with anal bleeding. The source of bleeding within that context, the expectation is that it's traumatic. It could be the hemorrhoids that have been traumatized. It could be internal tissues, or it could be the development of an anal fissure. Many times, resting the bottom, increasing fiber intake, possibly adding a stool softener will allow you to have soft, comfortable bowel movements. And you do this for about 5 days, just to give the bottom a break to allow those tissues to heal.
Do you have a preferred stool softener?
There's options. So you want the basics, you could do Colase. Colase is something that's not going to give people you don't want diarrhea in this context. Right. So you just want something that's going to kind of just keep it soft. So Colase can definitely get the job done. Now, if you have experience using magnesium, I'm a huge fan of magnesium, specifically magnesium oxide, citrate, or sulfate. Glycinate and threonate are not for pooping. Those are for sleep or other magnesium needs. But citrate, sulfate, oxide, those three, if you have experience with them, I think they're wonderful stool softeners.
I agree with everything you said. I would add that use an anal appropriate lubricant. So the pH of the vulva and vagina is different than the pH of the anus. And so there are specific lubes that are marketed for anal use. And I would tell people to use those and don't use homemade products or Vaseline or things like that.
100%. Out of curiosity, while we're on the topic, water-based lubricant versus silicone-based lubricant, what are your thoughts on that?
So in general, I think it's really personal preference because the water-based will evaporate. So depending on how long you're going to have intercourse with, I tend to like longer acting lubricants, which would be either oil-based or silicone. With anal sex, I would caution people that you need to use protection. There's actually, as you mentioned, potentially more trauma in this area, which means you're at higher rate for STDs. And because there's no pregnancy risk, people often skip that. But if you're with a partner and you both are not sure of your STD status, you should, incorporate some condoms or some sort of protection.
Yeah. I guess the other thing I certainly can add into the conversation from my perspective as a gastroenterologist is I do think that it's helpful to have good, regular, complete bowel movements within this context of talking about anal sex. And one of the ways that you can help to accomplish this is with an evening fiber supplement, possibly some magnesium of the three types, oxide, citrate, or sulfate. Fiber supplement, possibly with some magnesium taken in the evening the day before, which allows you to have a good, complete evacuation in that morning. I would caution people against the use of enemas and things of this variety, even the water-based ones, because the evidence is actually quite clear. Unless those are done for a true medical need, they disrupt and damage the gut microbiome. So this is a big reason why I'm pretty strongly against colonics. Because I'm worried that people who use colonics and they're like, oh, I feel better. Yeah, you do. Because you probably were backed up and you evacuated your bowels and that gave you a blissful feeling. Right. But if we could get you more regular with better bowel movements, you would have that same blissful feeling without getting so backed up and not require a colonic that probably is washing out your microbiome.
I've seen this a lot. I've seen people don't realize they're constipated. Definitely in urology. They just don't realize it. Just for people who maybe are in that category, how would one know that maybe they're not having full evacuations?
All right. So there's a couple clues. Let me start with this. I mentioned this earlier. In my experience, 100% of people who are constipated, they have bloating, at least on some level. Many times that bloating is associated with food intake. And they think that they have food intolerances. But here's what's different about this. It's not specific to certain foods, right? It's not just dairy causes bloating. This is generically, everything causes bloating.
Okay.
Sometimes even drinking water causes bloating. Well, water is not fermentable. So it's not a food intolerance. What's happening there is that your motility is getting activated by the water. And you're feeling bloated as a result of that motility that's struggling with this burden of stool that you have inside of you. All right, so bloating is the first thing, but there are many other symptoms that come with constipation. So not everyone will have all these, but think of what is applicable to you. It could be discomfort, maybe a dull discomfort. It may go to your back. It may be a sharp discomfort. It may come in waves and be worse after eating. You may feel it in a specific location. You may also have fatigue. You may lose your appetite. You may get a dull nausea. Not necessarily enough to vomit. So all of these things, acid reflux can be a manifestation of constipation.
Really? I didn't know that.
Yeah, because the stomach stops emptying. So when the colon shuts down, the entire system shuts down because it's kind of like a conveyor belt in a factory.
Yeah.
If the back end isn't working, you got to shut everything down.
Yeah.
Yeah. So then when it stops sending it down, you start sending it back up. So if you are someone who has bloating in combination with acid reflux type symptoms, consider this possibility. Now, these are the symptoms. There's also the experience in the bathroom. A good bowel movement. I talk about these things all the time. So I'm like very in
No,
the
it's
same way
okay.
that
I do too. I talk about bowel movements with my patients all the time too. So I'm like, tell me more, so I can tell my patients.
You could handle this, but I feel the caveat for your audience that's like meeting me for the first time, like, wow, this guy really is comfortable talking about this stuff.
We love it.
Cool. So a good bowel movement is where you sit down, you have the urge, right, which leads you to the bathroom, and you sit down and you're comfortable and relaxed. And you allow this release of a bowel movement, and it is a complete release. You are satisfied when you're done, and you walk out the door, and doves fly in slow motion, and fireworks are going off, and your wife, in my case, looks at me and goes, "Whoa, what's up with that guy?" You know what's up with that guy, babe.
It's so underrated, though. Good bowel movements and good urination, underrated.
Oh, I totally agree. I think it's the best way to start the day.
Yeah.
Honestly. And when it's not well, it's miserable.
Oh, yeah. I mean, we see it all the time.
All the time.
All the time.
So, all right. So when you deviate from this, though, Rena, where you push and strain to go just to have a little nugget, or you feel like you went, but then you got to go again. Those are incomplete bowel movements. So, and that can lead to you backing up. And many times people will say, oh, well, I poop every single day. There's no way I'm constipated. I poop every day. Yes, but is it a complete bowel movement? Are you fully emptying, or did you give me a partial?
Yeah.
Because pooping out 25% still leaves 75% inside. And if we compound that 75% tomorrow, the next day, the day after, you're very backed up.
Yeah.
When push comes to shove, if you really want to know, get an abdominal x-ray. All right. Push comes to shove, that will answer the question. But most radiologists will not comment on poop.
No,
unless you specifically ask them.
Even in CT scans, sometimes they don't.
No, they
comment.
don't.
Yeah.
So, and if they do comment, they'll go, oh, that's mild to moderate constipation. Oh, no. That is severe constipation.
Yeah.
They are like very backed up.
Transverse colon. You're like, okay.
Exactly. So, but the key here is that when you request this test with your doctor, you have your doctor explicitly ask the question, is there constipation? ?
I mean, I could talk to you for hours. I have lots more questions. Maybe we'll have you back another time. But I want to respect your time. We end our podcast with 4 questions we ask everybody. And they can be about your profession or not. What's something you know now in life that you wish you knew earlier?
I'm about personal growth. And for me, it's about identifying new frontiers or opportunities for doing better. And I'm really right now into the opportunities that exist in interpersonal connection and spiritual connection. I think that these things are necessary and important to us as humans. We all have that. We all need that.
Yeah.
So, and I think we're missing that in today's society.
Yeah, no, I think that's important. I think you need connection with something, whether it's spiritual, community, something bigger than yourself. What is a non-negotiable besides having a poop? Because I know that's going to be one. What's a non-negotiable for you? Something you got to do every day.
You know me too well. I have found that, so much like you, I have a rigorous lifestyle. In order to maintain a high level of performance, I found that I need to have my exercise.
Yeah.
It helps me manage stress. It also gives me the energy and allows me to be focused. So that's my non-negotiable.
What's a life hack or health hack you'd share?
You know what? I mentioned earlier the mornings. So I'm a big believer in morning walks. Like to me, it's 3 birds, 1 stone. When you get natural sunlight through your eyes, when you are actively working and you're spending time outdoors and getting a little bit of exercise, like you get like this multiple birds with 1 stone. Another hack to me is like, let's flip it over to talk about the evening. I think that consistency is really key. So like creating a 1-hour window and saying it to yourself, committing, I'm going to go to sleep during that 1-hour window, right? And trying to maintain that consistency. And then with that, early dinner time.
I like early dinner time for sure. Allows yourself time to digest, right?
It gives you time to digest, and you're creating a window where your gut will actually be able to rest. So it's not that like fasting, it needs to be 20 hours or whatever. It's not that more is necessarily better, but it is nice to give your gut a break for about 12 hours.
If you couldn't be a gastroenterologist, an author, an entrepreneur, because you're all those things already, what would you be?
It's very clear. I would be a rock star.
Love that. Where can people find you and where can they find your supplement? Everything they need to know.
Come join me at theguthealthmd.com. I have an email community of about 200,000 people, and we have a lot of fun. And I do AMAs. I love like breaking down brand new studies that just came out. Like that to me is my favorite place to like have a chit chat with my community.
Yeah.
Totally free. Social media, you can find me at the Gut Health MD. And then 38 Terra, this is something for people to pay attention to. Like if you're serious about gut health supplements, we're serious about creating the best gut health supplements that exist. So 38tera.com. Come check it out, read about it, shoot me a message if you have questions, read the reviews. I highly encourage all that.
Awesome. Thanks so much.
Thank you, Rena.
Thank you guys for joining me today. If you guys enjoyed this podcast, make sure to screenshot it, comment, or leave a rating or review on Apple Podcasts. And as always, remember to take care of yourself because you're worth it.